Hello, everyone, and welcome. Thank you for joining us. This is the webinar on attack on healthcare in Gaza. It is hosted by Physicians for Human Rights Israel. I see people are still joining, but we're going to begin. So again, thank you for joining us at this time of the day or the evening. My name is Tirza Leibowitz, and I'm the Deputy Director and Director of Programs with Physicians for Human Rights Israel. I will give a short introduction about the webinar and then introduce the panelists, and we will go forward from there. So Physicians for Human Rights Israel is a human rights organization. It is based in Israel, registered in Israel, focusing on the right to health of people under Israel's responsibility or control, looking and addressing at structural inequalities through a combination of both policy change and also direct targeted services within Israel and the occupied Palestinian territories. The context of our webinar is the multi-pronged systemic attack by Israel on Gaza's healthcare system and the profound effect of a decimated system on every aspect of life and the possibility of the life of the collective in Gaza. Now, PHRI works in an ecosystem of actors, many of whom are following to this context, and many of them are partners, and some, I hope, also have joined. In this webinar, we want to piece together with you and share with you an understanding of the systemic nature of Israel's attack on Gaza's healthcare system. So this is rather than focusing on an incident or a collection of incidents or even on one particular lens. Thus, we will follow the attacks on infrastructure, on hospitals, on people, on the harming and the killing and mass detention of healthcare workers, and on rendering a health system near obsolete while preventing or weaponizing evacuations. These areas touch on PHRI's long-standing work around violations in the occupied Palestinian territories and also within the prison systems, which is why we will hear from my colleagues from both of these departments at Physicians for Human Rights Israel. So we will be hearing from Aseel Aburass. Aseel is the director of PHRI's Occupied Palestinian Territory Department. And with her team, she is following and documenting, in addition to Gaza, attacks also on medical teams in the West Bank, among others. We will also hear from Maha Loulou, who is a project coordinator in the Department on Prisoners and Detainees at PHRI. And Maha and her team address the most pressing violations relating to health in the prison system, within which the abuse and torture of Palestinians is rife. And Maha is also the co-author of a recent report, The Plight of Gaza's Medical Workers in Israeli Custody. Now, understanding the common features of what has transpired in Gaza, but also unique ones, as in Syria, Myanmar, Ukraine, will provide us with further tools to grasp the scope and the implications of the attack on Gaza system. And so we are thus grateful to have with us Len Rubenstein. Professor Len Rubenstein is Distinguished Professor of the Practice at the Johns Hopkins Bloomberg School of Public Health, and he's Director of the Program on Human Rights, Health, and Conflict, also core faculty at Johns Hopkins Berman Institute of Bioethics, and a non-resident fellow at the Center for Strategic and International Studies. Len, I know that you'll be also sharing with us your experience from the Safeguarding Health and Conflict Coalition, which you founded, and also from your book and your analysis, Perilous Medicine, the Struggle to Protect Healthcare from the Violence of War. So why does all of this matter? Why are we trying to understand the systemic nature of the destruction? It matters, first of all, for the purpose of understanding accurately what is unfolding. It also matters for assessing claims by the Israeli government and the military about inevitability or justifiability of the harm that is inflicting, or that they are discharging their humanitarian duties according to international law. It is important for accountability efforts for when the legality of these steps will be litigated. And more immediately, it matters for grasping the role that the destruction of the health system plays in the broader, and at this point, explicit agenda of forcible transfer, ethnic cleansing. And it is really, it is needed to help inform what we, PHRI and like-minded allies in Israel, in Palestine, and around the world can do. One last opening comment, we will focus on PHRI's toolset. So we work with communities, with the medical communities, and we target the medical communities as well. And thus, we will also have a chance, importantly, to talk about solidarity, or in some cases, lack of solidarity, but hopefully a lot about the solidarity within and by the global medical and healthcare community, and what more can be done. So before going into the core and the content of this webinar, just a word about the run of show. We will do a few rounds with the panelists, with Aseel, with Maha, and with Len. We'll do a couple of rounds of questions to bring out the content of this webinar. You can all see the chat function. You can also see the Q&A function, and you're welcome to put in either comments or questions, which we will then, I will be following these functions, and we'll be able to integrate some of these questions back to the panelists. We will go on for an hour, and without further ado, first, welcoming all of you, welcoming our panelists, and going into the first round of questions. So I'd like to open Aseel. If you can help lay out the land and talk to us about the health system in Gaza, you know, before the war, how it stands in relation to the West Bank and East Jerusalem, and what has transpired since the beginning, since October, to give us a lay of the land.
Good evening, everyone. Thanks for joining us in this important conversation. So I will start with a few words about the Palestinian healthcare system before October 2023, because there's a mention. It's crucial to understand not only what is destroyed now, but it's also crucial to know how the current situation looks. But also, it's very important to know what existed before and how fragile the system already was. So when we're talking about the Palestinian healthcare system, we're talking about a system that has already, especially the Gaza healthcare system, it's a system that has been already under decades of systematic pressure, blockade, 16 years of blockade. Controlling not just what goes, Israel has been controlling not just what goes in and out, but also people's access to healthcare outside of it, adequate healthcare. The system was always operating under severe shortages, whether it's limited the medications, limited the equipment, understaffed hospitals, delayed permits for patients who could access care outside of Gaza, and constant obstacles to refer them to the West Bank or East Jerusalem. It's very important to say that this wasn't a normal healthcare system, you know, that suddenly has got bombed and it looks the way it looks now. It was a system that has already been repeatedly pushed to every possible edge. Especially during each war, each military escalation, whether it was 2008, 12, 14, 18, 21. Every few years, there's a new, round of war, and a new round of violence that would hit Gaza hospitals, and each time the healthcare system would try to recover, but it has never fully was able to rebuild. So by 2023, it was already in a state of chronic emergency. And to give one example, by the end of 2022, according to the WHO, nearly half of essential medicines were completely out of stock in Gaza. That means that hospitals couldn't even perform basic treatments, and that was before the current war. And all of this is a result not only of Israel's long blockade on Gaza, but also of the deliberate fragmentation of the Palestinian healthcare system. And to answer Tirsa's question, when we hear about Gaza's healthcare system or the West Bank, East Jerusalem, it sounds like there are three separate sectors, but this fragmentation was never natural. It's a political outcome. It's a deliberate policy of separating Palestinian life and governance, which include also the healthcare system, but it's not supposed to be like this. The Palestinian healthcare system was meant to function as one independent unit, Gaza, West Bank, and East Jerusalem. And what Israel have done through its illegal permit regime, the physical barriers, the legal classifications, it basically systematically isolated Gaza from the rest of the world, more specifically from West Bank and East Jerusalem. And the result is that we see it now is that each part of the system basically becomes weaker, and we can see it's not just bureaucratic. Through our work, through PHRI work, we could see this fragmentation and consequences of it from our work. Patients needing for the war, patients still who needed the permits to leave Gaza for urgent medical care. Sometimes they wait for weeks, sometimes even for months. Doctors in Gaza who want to get advanced, for example, medical training in the West Bank or East Jerusalem are not able, they're not permitted to do that by Israel. So it not just affecting the medical care, but it also affects the lives of people and their chances to survival at times.
Thanks, Aseel. And if you can just give us a quick overview, because of course we're going to go into a bit more detail about what actually transpired on the ground, but give us a sense of today, you know, the extent of the attacks on infrastructure, just so we have a sense, like a basic sense. We'll go into it a bit later as well.
Yeah. So I think to go over this war has been since for almost a year and a half. If I want to talk more specifically about since the end, Israel ended basically the ceasefire on 18th of March. Since then, Israel has been bombarding Gaza again. There's a full return to war. Borders currently remain sealed. There's humanitarian aid is blocked. This is the situation on the ground now. Essential supplies like food, water, electricity, medicines are scarce. Every report that is coming out right now from Gaza is showing that devastating numbers of famine and hunger. People are basically dying, not just from airstrike now, but also from starvation, dehydration, and collapse of the medical services. And yeah.
Thanks, Aseel. And again, once again, just so we understand, like, the operations of hospitals right now, or the extent of attacks on the hospitals, the repeated nature of it, just a sweeping overview. Like, how does it look on the ground, having gone through the year and a half?
Yeah. So I will take a step back to answer this question, because PHRI, the way we look at the way we documented this past year and a half is that everything that is happening is not a consequence of war. We see it as a deliberate strategy. There is a systematic targeting of Gaza's healthcare infrastructure, and by now it's evident and well documented. to mention that by January 2024, almost more than a year ago, 13 out of 36 of the hospitals of Gaza were only partially functional. And as of May 2024, WHO has documented more than 450 Israeli attacks on Gaza's healthcare system. And these attacks we know by now that these attacks have destroyed the majority of a hospital and basically made them non-operational, either through the direct strikes or by cutting off essential supplies like fuel and electricity. Of course, when we talk about the targeting of the healthcare system, we don't mean just the buildings themselves, because by now, over 1,400 healthcare workers have been killed since October 2023. These are doctors, nurses, paramedics, individuals who have dedicated their lives to save their people in Gaza.
Thanks, Aseel. That's helpful. Len, just turning over to you. The attacks on healthcare systems are not new. They are familiar from from history throughout today. And if you can just give us just a run over of the protected status under international law, like why. What is it and why, and also the common elements that you see if you're looking at other conflicts today.
Thanks, and thanks to PHRI for holding this webinar, and also for the important and courageous work you're all doing. As far as the law goes, the protection of healthcare was the first element of the protection of the Geneva Conventions going back to 1864. It was the only subject of the conventions, which established that there's something sacrosanct about healthcare and the protection of wounded and sick people and their caregivers in the hospitals they're in. That started a very long process over more than a century and a half to keep refining what those protections mean. And without going into great detail, I just want to outline 5 of them. Some apply to civilians generally, and some to healthcare in particular. The first obligation is to distinguish between civilians and military objects. That is, you can't attack civilians. So that is a crucial element of a protection, and that applies, of course, to civilian hospitals as well. A second is that all feasible precautions must be taken, even if the target is a military one, to minimize civilian harm. It's very strong language, to avoid or at least minimize civilian harm. And this applies in all military operations. And in addition to that, there's special protections for healthcare, which require much more extensive warnings than warnings in civilian attacks. The third is the duty of proportionality, which says that the military advantage gained can exceed the incidental harm to civilians in the attack. The fourth applies when, as happens in this war, is when there's a claim that the hospital is being used for military purposes to harm the enemy. Even if that's the case, the obligations I just mentioned still apply. So you have to minimize harm to the medical staff, to the patients, to the physical structure, to hospital operations, even if you're going after an enemy. And you can only attack if you warn in advance and the warning is unheeded. Finally, and very importantly, there's a requirement of respect for medical ethics. That means respecting impartial care, respecting medical judgment, respecting doing a professional job, and not punishing any health professional or health worker for acting in accordance with their ethics. And of course, we're seeing all of these rules being violated in Gaza, and I'll talk about that a bit later. Unfortunately, it's not only in Gaza that these rules are blatantly and openly disobeyed. They're disobeyed in wars, including Russia's attacks on Ukraine, when the Assad regime attacked hospitals 600 times in Syria, in the terrible war in Sudan, and also in Myanmar, which has involved not only the arrest of over 1,000 health workers, but targeting of hospitals where they have fled to. So we have this kind of violations all over the world, and sometimes they're done for strategic reasons to demoralize the population, to force population movement. More commonly, they're done for tactical reasons because it's convenient or because you don't want to have the kinds of rules of engagement that are required to prevent harm. So it's just a tactic of war. There's also arrests and attacks on health professionals precisely because they're doing their job, because they're impartial and offering care to all patients. And under the guise of counterterrorism, people offering care are arrested and sometimes killed. So that's a brief overview, and I'll come back to uh, Gaza in a minute. But I'll just say that Israel began the war by claiming that it complied with all these obligations. They recognized international law, but they offered interpretations that twisted them out of all recognitions and emptied them of any protections. Now you see that the IDF is not even claiming, they don't even address the issue of compliance. They don't talk about warnings. They don't talk about precautions. They basically abandon any pretense of abiding by these rules.
Len, you mentioned the issue of arrest and detention of healthcare workers, which is a great segue for Maha. Maha, your department has been working on the issue of prisoners across the spectrum of the way the right to health is violated in the prison system. At what point were you noticing the issue of arrest? I mean, there have been massive arrests of people in Gaza. At what point were you noticing that there is arrests, targeted arrests of healthcare workers? Like what were indications from the ground, and what did that lead you and your department to do?
So first of all, thank you for everyone who's attending and taking interest in this webinar. So basically, we started noticing the mass arrests of healthcare workers in December of 2024 with the first incursion of Al-Shifa Hospital. Marked a start of a arrest pattern involving multiple medical facilities. We saw this pattern repeat itself in Al-Awda Hospital, in Kamal Adwan Hospital, in Nasser Hospital in March of 2024. And it continued with the second wave of arrests in Al-Shifa and in Kamal Adwan, in Al-Shifa in March of 2024, and Kamal Adwan from October to December.
I'm going to have to stop for a second. We're getting a siren here in Israel. I suggest that usually we are able to return in a few minutes. Please stay with us, and if we see that we cannot return, we'll let you know. But please, colleagues who are in Israel, we should go to the safe room, and we hope that you can stay with us in the next few minutes. We'll let you know what the status is. Thanks. Colleagues, sorry for this interruption. So we'll continue. So Maha, you were talking about the indications for you that there was a targeting of healthcare workers. If you could just take a step back and share that.
Yes, of course. Before we continue, I'm sure we're all aware that in Gaza they do not have alerts or safe rooms. So let's keep our people in Gaza in our prayers now more than ever. On that note, as I was saying, we started noticing mass arrests of healthcare workers with the first incursion of Al-Shifa Hospital, which was in December of 2024, which kind of opened the doors, sort of, for this pattern of arrests of healthcare workers involving multiple medical facilities. We saw in March of 2024 mass arrests from Al Auda Hospital, from Kamal Adwan Hospital, and from Nasser Hospital. And this continued with a second wave with the second incursions of Al Shifa in March of 2024 and in Kamal Adwan Hospital in October to December of 2024. So as a result of this information, the Department of Prisoners and Detainees decided to reach out to other human rights organizations in order to inform them that we are now directing specific attention to the detention and conditions of healthcare workers in order to not only assist healthcare workers that are being detained unlawfully, but also to further investigate these emerging patterns. So starting in June, when the Israeli army started permitting PHRI lawyers to visit detained healthcare workers from Gaza, we were provided with valuable insights and we became aware that healthcare workers were being detained specifically because of their profession. We learned that all healthcare workers that we have visited were detained either from hospitals where they've been working at the time of their arrests or while crossing checkpoints after Israeli soldiers found out that they work in the medical field. And some healthcare workers even mentioned that the treatment towards them became worse when soldiers found out of their profession, whether that was at the time of their arrests or whether in times of their interrogations after their initial detention. So because the Israeli army refused to provide any information regarding these arrests, it was at first difficult to determine accurate numbers of detained healthcare workers. Some were killed and their bodies were never recovered, and some were subjected to forcible disappearance, which basically led to their whereabouts to remain unknown, both to their families and to human rights organizations. In total, and with the help of information provided by the victims' families, human rights organizations were able to document the arrest and detention of at least 250 healthcare workers from Gaza since October 2024. This number might have changed since it was last updated. And while some were released since October of 2023, at least 120 medical workers from Gaza remain held in Israeli custody as of today.
Thanks, Maha. And we're going to go back to you to hear also about what you're picking up from the circumstances of detention and what you're learning from that with regards to both the systematic nature and also the ability to justify or to address the way Israel is trying to claim that these places have been militarized. So we're going to get to that in a moment. But I do see that there are some questions coming in from the chat function, and I want to ask Aseel. Aseel, we have a question here coming about what is the situation of mental health and psychosocial services in Gaza. And not necessarily that I want you to address the question in general, but if you might want to address, particular places where we do have some connections. We are able to hear more directly about the situation in terms of psychosocial support. You may want to address around women and motherhood in Gaza. So if you want to take that question.
Yeah, I can speak something about mental health. It's really, really critical at this point. It's getting worse day by day, where the population is under constant trauma, bombing, displacement, hunger. And currently, there's no real system to support and to manage this. I don't know, just from videos that I'm seeing, we see kids who basically who can't sleep, stop talking, they're flinching at every sound. It's just from videos that we see on social media. The children in Gaza are there's more than 1 million children in Gaza, and according to WHO, almost all of the 1 million children are living with mental issues right now, and that's massive numbers. And while there's no real services that exist, UNRWA does cover some, doing what it can with the current situation also. But still, there's enormous need. And we know it's scary to think that there's also a whole generation right now that will grow up in trauma, currently with no tools to support or to heal. Through our work, we are currently also working with women that have experienced pregnancy and motherhood during this war for the past year and a half, and we're also hearing tragedy and catastrophic stories about what it means to be a mother in this war, about the fact that you need to sometimes choose between your meal and your child's meal, the fact that you see your child sleeping without food and them being hungry, the fact that you need to switch to basically you're displaced and you need to always go from one place to one place, that you can't access medical treatment, you can't access a hospital, you need to see your child in front of you and not being able to treat them, to give them medicine. This is things that are obvious for us, in the everyday life. Your child is sick and you just go to the nearby clinic, and it's not existing anymore. So it's not just the children, but also their parents who cannot. We're talking about trauma. Parents that can't. This is the basic instinct of a parent to protect the child, and even that is not available. Yeah.
Yeah, maybe I'll just add one more sentence about that. An environment of organizations and other actors, and it's very we work within boundaries and limitations, and one small thing that we can do, which Aseel, you alluded to, in some cases, all we can do, others may be doing other things, all we can do sometimes is document and provide a platform for voice. And Aseel mentioned working with mothers in Gaza. There's one thing about scope. We're talking about scope, and we're getting here in the chat, we're getting a sense of the scope of the destruction of the system, which is hard to fathom, and it's happening. And then there's also honing into particular people, mothers, families, and hearing and giving a voice for what they're going through. I want to go back to Maha just to complete the picture in terms of the personnel, because we talked about the detention where healthcare workers were detained. You talked about being detained in the hospitals and in checkpoints, and there's also the prison side of things, and what have you learned there as lawyers were visiting some of this, and word was getting out about the healthcare workers that detained there, that give a sense of, again, of the targeting. You can just complete that picture.
So we can see a lot of similarities in terms of targeting between the way Israel has targeted hospitals and the claims it made about the hospitals, and between the way it did so to personnel. So in their justification, let's say, for bombing the hospitals, Israel claimed, as unsubstantiated as it is, but it claimed that they were used as Hamas command centers. Of course, these claims were not verified, were unsubstantiated. So we can see that the arrest of medical personnel served Israel's campaign of delegitimizing the healthcare system in Gaza, which was notable in the arrests themselves, beginning with the arrest of Dr. Muhammad Abu Salmiye, which is the director of Al Shifa Hospital back in December 2023. So the Israeli army made sure to paint Dr. Abu Salmiye as a Hamas operative. It made sure that the public had this image of this senior doctor and equated him to a terrorist. Although Dr. Muhammad Abu Salmiye was released with no charges whatsoever after being held under Israeli custody for 7 months. This pattern seems to be apparent in all the arrests of healthcare workers, or at least the ones PHRI lawyers have visited. Most recently, it was also noted in the arrest of Dr. Hussam Abu Safiye, which is the director of Kamal Adwan Hospital, where he was broadcasted in Israeli national TV, a prison uniform, handcuffed, visibly unwell, and portrayed him also as a terrorist to the public. So the arrests of medical workers from Gaza are a key part of this bigger strategy of the delegitimization of the healthcare system in Gaza, in which constant attempts are made to strip Gaza's hospitals from their protected status under international law. So the arrests, we see them as a reinforcement of this propaganda. And through them, Israel has paved a very clear way for the complete destruction of the healthcare system in Gaza, in a way in which the arrests would paint healthcare workers as complicit to Israel's unestablished claims or accusations, which in its turn effectively criminalizes the whole system and legitimizes its destruction. So we see that the impact of these hospitals being emptied of its workers, of its doctors, its nurses, paramedics, ambulance drivers, all of these healthcare workers, while they're not there, you can see that it effectively becomes a death sentence for thousands of civilians, which are in need of this medical attention. They are the most at-risk population in this situation. And you can kind of figure this out through our visits, where one surgeon told us that he was the last surgeon when Israeli soldiers came into the hospital and arrested him, making the hospital empty of any surgeons, making him leave behind thousands of injured men, injured women, injured children, elderly, which were in desperate need of medical care. Another case was of a doctor, also a surgeon, that was taken, that was arrested in the middle of performing surgery. So you can imagine in a way how the impact of emptying these hospitals of their staff has on the population, on the civilians that are basically the most vulnerable at that time, in need of medical staff to be in their positions.
Thanks, Maha. And Len, I wonder if you want to add anything to what Maha was saying about the attempts to delegitimize by the militarization of the healthcare actors and places. But also I would be curious because we're getting a question in the chat with regard to legal action, what legal action is taking place. Now, we can say that the legal action within Israel to date, because PHRI and other partners in Israel have been applying to the High Court of Justice on several issues, some of them around trying to prevent and put some checks in terms of destruction of hospitals, others around what is happening in the detention centers. And the success has been very, very limited. I think we were not surprised by it. But if you can also, again, taking like a very, very kind of a long view, you know, what are circumstances that that provide the political scenery to be able to take steps on the international level?
Well, first, I want to affirm everything Maha said. I think she's exactly right that delegitimization is pervasive and it extends beyond hospitals and physicians and health workers in hospitals. Medical convoys, ambulances have been systematically targeted with missiles. You may have heard about the incident a few weeks ago where 14 Palestinian medics and a UN official were killed by IDF soldiers, despite the fact that the ambulances were marked, had lights flashing, their headlights were on, and the first IDF response was that they weren't marked, didn't have headlights on. And the attitude of the commander of that unit, the Golani unit, the brigade, was very clear. He said, everyone we encounter is an enemy. If a figure is identified, we open fire, eliminate, and move forward. Don't get confused about that. This is a lieutenant colonel speaking, head of this brigade. So we see this throughout the system. And there was a question about how Gaza compares to these other circumstances. I don't want to underestimate how terrible the attacks are in Sudan. And in Tigray and the war in Ethiopia, 80% or 90% of the health facilities were damaged or destroyed. But Gaza is very different in the systematic, relentless, repeated attacks on hospitals and health workers. And I've been working on this issue for 30 years, and I've never seen wholesale mass arrests of health workers in hospitals. The number of ground assaults in hospitals is unprecedented in my experience. There have been lootings of hospitals and arrests of people inside hospitals, but nothing like this. Nothing like continued incursions into hospitals that are accompanied by shelling, missile attacks, and bombings. And I think we have to recognize how terrible the situation is in Gaza and how the contempt for the law is so open and flagrant. As to accountability, our best hope is through the International Criminal Court. The court has never, nor has any other international court, prosecuted a case focusing on attacks on healthcare. That has to change. We know the investigations are going on at the ICC. We don't know what further indictments and arrest warrants will come out of this, but that is essential. It's also clear that under principles of universal jurisdiction, where people can be prosecuted for war crimes anywhere in the world, no matter where they take place, that should happen. There are countries that have spoken out against the attacks in Gaza, including especially the attacks on healthcare and on civilians. and they have the power to bring cases. Now, we know that the big concern in these cases is getting a hold of the people who are the perpetrators. That's extremely difficult. But there's also a track record. It takes time, but there are many circumstances where the perpetrators are ultimately held to account. And I think that has got to be the path forward. There has to be an international commitment to justice that hasn't existed so far, and it has to stand up against the U.S. government as well as the Israeli government and its other allies who try to delegitimize the International Criminal Court, just as Israel is trying to delegitimize the health system in Gaza.
We're getting a lot of questions here about what can be done and to continue the line of accountability, but on a different level, and bring it back to PHRI's close tools. Again, we work with the community of professionals. We target the community of healthcare professionals and doctors. And we have some tools in that toolkit in terms of enlisting that community. And I think we have begun taking some steps, and some of these have been successful. There have been approaches by doctors to medical associations asking, and there are different varieties of these. So there is the route of putting pressures on medical associations in one's country, in some of the regional ones, in some of the global ones, to put pressure back on peer associations and colleagues back in Israel. And that is a route that there are some efforts and more can be done. And Maha, I was wondering if you can share a few words about some other routes of pressure, but also solidarity within the profession around, doctors standing up for doctors. What has worked so far? Where have we seen some traction? What more can be done?
So we obviously saw a lot of international medical communities across the globe actively speak out against what's happening in Gaza, and specifically the detention of medical healthcare workers. We also have frame of our project that that PHRI, our department, released. We have as a part of the project, there was a document of testimonies made by healthcare workers from Gaza that detailed the horrific conditions that they're held in, the starvation, the abuse, the medical neglect, all of that. So as an initiative, PHRI doctors that volunteer in the organization have organized a solidarity movement of reading those testimonies to kind of give the picture of what if this was happening on the other side? Would it be met with the sort of neglect that we see from national medical associations, where we saw no attempt of demanding accountability. We even saw no sort of demands of ensuring the protection of medical healthcare workers, which are essentially their colleagues. We also saw that there have been no public demands directed at the Israeli Medical Association, which has not only failed ethically to speak out against the destruction of the healthcare system in Gaza, structure-wise, or whether it's personnel-wise. But it also acted as a direct enabler of the human rights violation, human healthcare workers from Gaza face in detention. So as much as we witness efforts from international medical communities, we can't help but feel a sort of missing out on behalf of the National Medical Association and most importantly, the Israeli Medical Association, which have not only not provided any comment, but also enabled a plethora of violations against essentially their colleagues, their Palestinian colleagues, whether it is in prisons and military camps or whether it's on the ground in Gaza.
I'll just add to that again, the community that we work with gives us a range of tools, limited, but a range of them. We have some whistleblowers through which we're able to get information, participation in some of the procedures that give us insight into what is happening. And we also have allies and colleagues in some of the medical associations around the world. And just a shout out to some of the committees within some of the associations who are getting together, who are organizing, who are sending letters to their associations. I think we have registered here on this webinar, we have the Australian committee that has went out publicly and written to the Australian Medical Association. We have some work that has been happening with the British Medical Association, and this work, there needs to be more done. These are things from colleagues here on this webinar who belong to these professional circles. This is an area that matters, where you can have an impact, where this kind of pressure can grow. And some of the approaches to the medical associations are publicly available, so you can see also how these are done, and that is something that we welcome and can also assist behind the scenes as necessary with information. We've also been asking, we've been asked here in the Q&A about the information that we have, and a lot of the information that we have is publicly available. It's made into publicly available information, and we're happy to help with any other requests for information. Just a question, maybe a last question as we wrap up here, to Len and to Aseel, if there's anything else that you'd like to address kind of in a very focused way from what we've heard here. And again, in terms of the questions, we're not going to be able to answer all the questions here, but we did get a question about the special rapporteur on the right to health. There was a question whether the special rapporteur was asked to investigate and speak out, and we have had formal communication, and also the special rapporteur coming out formally with some some declarations. There has been a fruitful collaboration with that. We're asked here about the U.S. medical community solidarity with Palestinians, and I would welcome any of you on this webinar who do have information about that. We'd be happy to learn more, and you're welcome to turn to us after the webinar. So back to you, Aseel and Len, if there's any particular comment you'd like to add here.
I just quickly, there was a question in the chat that I can also answer about, also Len touched on it a little bit. It's about Hamas's interaction with the Gaza healthcare system and what's the pressure they may place on it. And we spoke a little bit about it, but basically in very short, Gaza's healthcare system, we already said it's mostly made is a civilian healthcare system. It's made from public hospitals, UN clinics, NGOs, and through all this war, Israel kept saying that Hamas uses hospitals, but also Len explained it very thoroughly that at the hospitals that there was no real evidence up until this point, and it is mostly used to justify, the attacks and basically ending up putting the whole healthcare system in risk, the patients, the doctors in danger. And the collapse of the system isn't because of Hamas, it's the years of blockade, isolation, and the direct attacks of Israel. And to just wrap up Also, Tirsa mentioned a little bit, really our scope, our tools are limited because of what's happening. But what is happening in front of our eyes is to say catastrophe is an understatement. It's a genocide. And documenting and speaking about it and advocating for it is the only tools that we have left so far. So because at this point we know that we couldn't stop it, but we want to make sure that it is recorded, and that's why we're speaking about it, so that perpetrators will not be allowed, to walk away without accountability, and so that for that not to happen again also in other places in the world.
And thanks, Aseel, for taking that question from the Q&A about the interface and the interaction with Hamas. Len, any closing remarks, and then I'll just close.
And after I speak, I have to get off. I'm getting kicked out of the room I'm in. One thing we just haven't talked about is the humanitarian aid, which is considered a separate issue from healthcare. But we know that basic medical supplies, anesthetics, painkillers, they have been obstructed since the beginning of the war. And of course, for the last 2 months plus, no medications are getting in to speak of because of the total blockade. And we shouldn't forget the relationship between those violations and the attacks. So I'll close, but I just want to once again thanks Physicians for Human Rights Israel for your engaging in your commitment to this issue, and for the health workers in Gaza who every single day are putting their lives on the line to serve their people. So I will get off now, and thank you for the opportunity to participate.
Thanks, Len, and thank you for bringing up the issue of humanitarian aid. I also mentioned it at the start that, and as we speak now, there are advocacy efforts being made to make sure that humanitarian aid is not twisted into